Alright, so welcome to Muscle Anatomy series with Medic Vic, and we're just going to be discussing about anatomical questions, and from now on until we are getting tired. Alright, so let's look at this question. Muscle anatomy. A 23-year-old male was admitted after a motor accident involving a fracture to the surgical neck of the humerus. Physical examination reveals weakness in an arm adduction from 15° to 90°. The patient also reports loss of sensation over the lateral aspect of the upper arm, that's the regimental batch area. What muscle is paralyzed? And we have a list of options here. We have the supraspinatus, the pectoralis major, the deltoid, and the coracobrachialis. Alright, so look at this question. Let's analyze the question. First of all, the part that I highlighted, the question involved the guy in question here. He had a fracture to the surgical neck of the humerus. Now, the humerus has two necks. We have the surgical neck and we have the anatomical neck. The anatomical neck separates the head of the humerus from the greater and the lesser tubercle, right? And then underneath it, we have the surgical neck, okay? And fracture in the humerus actually most likely occur at the surgical neck of the humerus, okay? But this question is actually a popular anatomical triad question because this involves muscle, nerve, and muscle, nerve, and bone, right? Muscle, nerve, and bone. So what muscle here is paralyzed? That's the question. Okay, so let's look at it now. There's a nerve that coils around the humerus, and that nerve is called the axillary nerve. The axillary nerve majorly supplies the bulk of muscles called the deltoid muscle, right? It supplies the deltoid muscle majorly, right? Okay, so the axillary nerve supplies the deltoid muscle, and if I'm looking at the option here, A, supraspinatus, the muscle that supplies the supraspinatus is the nerve supplying the supraspinatus is your subscapular nerve. All right, and the question also says that there's a weakness in abduction from 15 to 90°. Now, the supraspinatus it helps to abduct from 0 to 15°. Abduction is moving your arm away from the trunk, not the trunk rather, away from the midline of the body, right? All right, this side, your side of the body, right? Moving your arm like this. So from 0 to 15° your supraspinatus, but from 15° to 90° is your deltoid muscle, right? So supraspinatus is out of it because number one, the nerve that supplies the supraspinatus is a subscapular nerve. You have the pectoralis major. The pectoralis major, the nerve supplying the pectoralis major is the medial and lateral pectoral nerve, right? And it actually supplies the shoulder, not the shoulder rather, but the chest region, right? So it can't be the answer because we are looking at three things here: the fracture to the surgical neck, right? And the nerve that is being affected here is the axillary nerve. And then we have abduction of the arm, failure and weakness in abduction of the arm from 15 to 90°. All right, number 3 is deltoid, which is obviously the answer because the deltoid muscle actually it actually originates from the lateral aspect of the scapula, of the clavicle rather, right? The acromial end, and then also, right, the musculocutaneous nerve is the nerve supplying the coracobrachialis muscle. So the answer here is obviously deltoid muscle, right? How is it deltoid muscle? We know that the nerve that is being affected here is the axillary nerve because we are talking about a fracture to the head of the humerus, and then the abduction of the arm from 15 to 90° is your deltoid muscle. From 0 to 15° your supraspinatus, and then from 90 to 80° is actually your serratus anterior muscles, right? But from 15 to 90° is a deltoid muscle, and loss of sensation over the lateral aspect of the forearm here. The axillary nerve is responsible for that sensation felt, all right, in the is the regimental batch area, right? That's the batch, most of the that's I think around this area, right? The regimental batch area. So yeah, the answer is deltoid muscle. All right, so that will be the end of this series. Do like, comment, and share. Also subscribe. All right, let me hear your thoughts in the comment section.